Hi there. We're really excited that you're going to participate and engage with us on our upcoming merit rounds at McMaster University on increasing and improving data capacity in the medical education research sector. And in particular, we're really going to be thinking about how we share data across institutions in the training trajectory to make bigger data sets for analysis and research. We'd like to start by just letting you know briefly who we each are. I'll start. I'm Lawrence Grierson. I'm an associate professor with the Department of Family Medicine here at McMaster University, and I'm appointed as a scientist with merit. I have a broad research program that focuses on understanding the relationship between education practice and policy and the downstream delivery of healthcare to communities and patients in Canada. And this is my colleague, who I will let introduce himself.
Thanks, Lawrence. I'm Kulasegaram. I'm an associate professor in family medicine at the University of Toronto and a scientist at the Wilson Center. I'm no stranger to merit. I think I knew it best in its former incarnation as PERD when I was a graduate student there. And so it's nice to be back among all of you. My research has been primarily around how we use assessment to inform learning at the level of the individual and how they can become more effective and better at things like clinical reasoning. But increasingly, and where this work sits, is how we use assessment data to inform systems and practices, which is really what our work is about. We're big data people, but the work has started because, and the context for this work is that we can't just push a button and create big data as Amazon or Google might. In medical education, we have to put data together, that is, share data across the components and constituencies of the continuum of training. To speak to that goal that Lawrence talked about, how do you understand the impact and role of education in impacting the system? You need to put data together to do that. And where this work sits is, how do you actually get the data together?
Yeah, so in our presentation, we're going to share with you some SSHRC-funded work that we conducted over 2020 and 2021, wherein we brought data stewards and key education stakeholders from across the Canadian education continuum together to build consensus on best practices for interinstitutional data sharing for medical education research. So we brought together a whole wide group of people, including representatives of the 17 training schools, the regulatory authorities in Canada, the colleges, the medical council, and a number of student and resident and physician advocacy groups who reflect the interests of a wide array of education constituents to discuss the risks and benefits of education data sharing for research purposes, to establish a set of values that can underpin our progress through this sort of muddy landscape of big data and education, and ultimately to develop a set of recommendations that can inform and guide researchers who are interested in conducting this work. So that's what our presentation is about. If we had to say that there's three key takeaways for the research, I would say is that what we're going to present is not binding policy. This is something that we want to make sure that we're clear about. It's principle based and offers guidance primarily. The second takeaway is that our community, our collective community, really emphasizes and agrees that values of non-discrimination, respect for informed consent, privacy and confidentiality are paramount, and stand right alongside respect for autonomy and data sovereignty in the conduct of work that we deem must be appropriate for advancing the education mission. Lastly, the last takeaway is that there's still a lot of work to do, and just developing these principles and values is insufficient. We have to find ways, such as this presentation, to disseminate and socialize this work broadly through our community, so that people start to take it up. So we're looking forward to talking to you about that.
If you'd like to know more, you can visit www.dataconnections.ca. That resource has a draft, or actually not a draft anymore, it's the final version of our consensus statement that's gone through several rounds of consultation, English and in French. It also has some e-modules in which you can use to share with graduate students or other trainees who might be interested in learning more about the work and the process.
Come to our show, ask the good questions, and we're looking forward to reconnecting with you all in person and virtual, and all the various hybrid ways that we do that now. So we'll see you at the show.
See you soon, everybody.